Hello, everyone. Testing, testing. Hello, everyone. Testing. Hello, everyone. Testing. So I look like I duplicated um the so I'm trying to get rid of one of the let me see. I duplicated the session, so this one I'm gonna have to uh delete. So just give me a few minutes. Mhm. Okay, hello. Okay. We're gonna start shortly. I think we're almost there. It looks like from past experience that I have to keep refreshing. All right, so we're going to start. Welcome. Okay, this is Nurse Gina here. Um, I this is my page, Gina Rose. Rose is not it's like a nickname, but my last name is Rosers. Um, I've been travel nursing for about more than 10 years. Actually, I started back in 2009 when I was living in the Michigan area and did some travel nursing. That's my background. But I've done med surg for a while, and then um, I've been working for agencies, and they will send me some med surg, med tele, But it's not until recently, about 2022, 2 years ago, that I got certified as a med surg nurse, and this was after working on a COVID unit, plus recently working on an observation unit, and that was my inspiration to finally get certified. Prior to getting certified, I became a member of the Academy Medical Surgeon Nursing Organization, which is abbreviated AMSN, which, by the way, is having a convention coming up really soon. So I will encourage, if you are med-surg, to go nurse to go to the convention. If you're not able to go in person in Toronto, they have a virtual access. They have a virtual access option. I'm testing the volume. Testing, testing the volume. Okay, testing the volume. All right, so we're at the Prometrics. Let me see. Did I lose? Okay, look like I might have stopped. So I'm gonna go back. Yeah, I guess we're back to so this is the Mometrics page. While we're studying, I would like for you everybody to just follow, and then on your own spare time, you can go back to the Mometrics page and practice on your own. But just to work in it together, I'd rather you follow with me. Um, so this test, so this test mimics the actual test. So it has 150 questions, and all the questions on the actual test is also multiple choice. Okay. So this is the first question, which talks about Maslow hierarchy. I wouldn't spend too much time on these type of questions because they are pretty much, you just can do a review, but I wouldn't spend too much time. Just kind of read over it and get yourself familiar, but um, all right, so we're gonna go ahead into question two. A patient has a complete colectomy with an ileostomy. What is the nursing action that is more important for this patient? Is it A, B, C, or D? I'll give you a few minutes to look at it. If a patient has a colectomy with an ileostomy, what is the most important nursing action? So I'm gonna go ahead and answer The point of today is just I just want to point out how this test works, and most importantly, when you're doing your own personal review, I would like for you to focus a lot on the answers, and like after you finish the test, and the rationale. That's so that way you can have a deeper understanding of the content. So that's the purpose of today's review, is just to kind of highlight important questions and to be familiar with looking at the rationales. Okay. Here is another important question on hemodialysis. When I took the test, and I have to be full disclosure, I took the test more than once, and this questions on dialysis came up on like both of my tests. So just have an idea like how things work with dialysis. And it also helps for you to take this test after you've been practicing for a while. That's why it's recommended that you have at least 2,000 clinical hours before taking this test. Okay. So when do you give a patient a medication if they have to go to dialysis? Question 4, a patient diagnosed as pre-renal failure. The nursing intervention that is top priority is what? If they enter pre-renal failure, what is the priority? Is it antibiotics, IV fluids, reposition? So when you looking at these questions, have an idea which one to eliminate. Reposition frequently is not a priority for pre-renal failure. Providing frequent oral hygiene, this is not a priority. The question asks what is the top priority. So C and D is not it. So maybe A or B, if anybody is following, which one do you think it is? Anybody want to answer? Let me see if anybody's following. Okay. So if anybody's on the following or on the Zoom, okay, so for this one, just think about about your kidney patients. I'm gonna go ahead and answer B, and then we're gonna see if we got it correctly. Number 5 is your stroke patients. I'm just gonna go number 6, a patient has been examined by the nurse, has been burning point tenderness and a positive jaw sign. Which of the following is most likely diagnosis? Anybody familiar with what a McBurney point tenderness is? Okay, so I'm gonna go ahead and answer, and we're gonna see if we got it correctly. So in these situations, you wanna be familiar with all of these answers. You wanna know what a pyelonephritis is. You wanna know what cholecystitis is. It seems to do with the gallbladder, inflammation of the gallbladder, itis. If pyelonephritis has to do with the urine, appendicitis, of course, is the appendix inflamed, meningitis. So just be familiar. Number 7 has to do with Cushing triad. I will do a note card on that one. Number 8 is a question that has to do with this patient went to get a contrast done and developed an allergic reaction. The allergic reaction was dyspnea, which was shortness of breath, flushing. The patient got bright red and pruritus. This was like having hot flashes and pruritus, okay? So definitely an allergic reaction, right? If a patient is having a allergic reaction, what is the top priority? They bringing up these same words, top priority. So it seems like everything is important, but which one comes first? Is checking vital signs at the top the first thing you will do? Ensuring airway, applying cold pack is not it. Applying cold pack probably does not seem like something that's super important at this time. Calling the physician maybe, but if you're thinking of top priority as immediate, something immediate reaction, we're gonna I'm gonna go with ensure airway. So let's see. When we're done, we're gonna see if we got number 8 correctly. Number 9, which is Erickson's psychosocial model. I will not spend too much time on these types of questions, but you can read it for future. 10 is about the same. It has to do with Kubler-Ross. 11 has to do with Orlando's nursing process theory. Maybe it's something you went over when you were in school, but honestly, I didn't see a lot of questions like that on the exam. Number 13 is something that you may be familiar with working with patients in the hospital. Patients who have clots. Which test do you see the doctor usually order for patients who have clots or deep vein thrombus? Okay, so in this question, we're gonna say it's the Doppler, and then we're gonna see why. A patient has been examined by the nurse, right upper quadrant with deep aspiration. What is the examination finding called? Okay, I believe it's the Murphy sign, and we're gonna see why again. So today's study's purpose is to understanding the why. The answer was is answered like this. A patient is evaluated for potential meningitis, which has to do with the brain. What is the following is not? So this you have to read your questions uh, very clearly. Take your time to read the question. Which of the following is not NOT capital a typical sign and symptom with meningitis? So what is with meningitis, which has to do with the brain, you'll get confusion, you'll get fevers with meningitis. So it could be A or B. Does anybody know what a Brudzinski sign is? Okay, so we're gonna say nystagmus in this case. If a patient is newly diagnosed with epileptic seizure, so that's another thing, and I'm gonna put the next time we have the more comprehensive study, I'm gonna do a PowerPoint and have some notes for anybody who wants my cheat sheet on what exactly to study. Seizures is one of them. Kind of be familiar with medications that they treat seizures with, how to position them. So in this case, they're asking what should be a steady state trough level of the prescribed drug. So this one you might have to do a little bit of thinking for this one. I'm just gonna answer it there. Okay. This one has to do with Narcan. Again, here's another seizure question. Number 20 has to do with what is the best position so they don't aspirate. So I'm just going to give you a little time to look at what you think is the best position to aspirate and then think about how you treat your seizure patients in the clinical setting. Okay, so this is 21 has to do again with patients on hemodialysis. So we can go over that. Numbers 22, I'm gonna just skip it to read for another time. Um, what is the most common organism to cause epidemics infections in the elderly? Um, I'm gonna answer this. Again, we probably for this study, we're gonna spend more time at looking at the answers and their rationale. Here again is another question on acute renal failure. I'm gonna give you some time to look at 25. And what complications happen with renal patients? See if you can guess the answer. Can you hear me? All right. Did anybody guess what the answer might be? So just kind of look at the okay. So the clue in the question is complication. So shortness of breath, chest pain, all these do look kind of like a for sure. Number the D, the last one, number four, is not a complication. Redness at the needle insertion site is not a complication. Okay, so it could be A, B, or C, really. But what complications find they said will be expected. So this one has two parts. Will be expected. So you will not expect shortness of breath or chest pain when someone is having dialysis. But the A you will expect. So this one I'm just gonna tell you which one it is, and then we're gonna go over maybe when we're done to see why the why. Okay. This one I'm gonna answer it, but I don't want to spend too much time on 26. It's another dialysis question. It's kind of like if you like I'm a person who's working and I don't do a lot of peritoneal dialysis, so I personally will not know the answer to this one. Number 27 is a good review. I know Down syndrome patients that kind of get an idea of what a renal disease is, but the Turner syndrome I don't work with a lot in the work setting. Osgood-Schlatter disease I don't see. It's not that common where I've worked. Even after being have done med search for a long time, I don't see this a lot. But for the test purposes, you do want to get yourself familiar with it, just in case it shows up on the exam. But Raynaud's disease is, I'm just going to tell you, it's when the patient's skin become erythematous, which is red when the patient is warm, and pale, almost cyanotic when the patient's hand and feet are uncovered. So this is, we're gonna go Raynaud's disease. So this is a good flashcard question. 28 again is another dialysis question that we can go over at a later time. Um, I'm just gonna go ahead and answer this one. Foley catheter. You see a patient with a bluish discoloration of vaginal mucosa. This is called a Chadwick sign. I'm just gonna go ahead and tell you what it is, and we're gonna see why. This one, I'm gonna give you time to figure out which one this has to do with stroke. While you're doing your private study, do spend some time doing a good review on stroke patients. And this one is probably a very classic type of question. Just know that if your patient has a stroke and is on the left side, always think about that the opposite side is affected. There's just general rule of thumb. If it's on the right side that the stroke is in the brain, then the left side, you're gonna expect left-sided weakness. So so I gave you some of it. So in this case, they want even more specific. Does the person have speech or visual deficits? So where did the stroke occur? It says left middle cerebral artery stroke. So it's on the left side of the brain and it's in the middle, left middle cerebral artery stroke. So which deficits would you expect? So we know it's on the left side, so we know it's gonna be either B or C. It's gonna be right-sided weaknesses. So now is it visual deficits or speech deficits? So we're gonna see where in the brain. I'm gonna say speech deficit, and then when we go over the answers, we're gonna see why. Number 31 is, the reason why it's A is because think of this as being a med-surg exam. And a med-surg nurse, we don't usually will unless we're in a group situation, we will not be commonly be administering dopamine, epinephrine, and vasopressin. Maybe on a critical care unit, they do that commonly, but when they say anticipated management, and they said it's asymptomatic, so this one I'm gonna say initiation of continuous telemonitoring. Okay, number 32, I took the test and I don't remember seeing any question phrased the way this one is phrased, but I'm just gonna skip over it because I honestly didn't see any question, phrased like this. It might, This one is, yeah, so I'm just gonna like, I'm gonna skip that one. A type of diabetes mellitus patient is admitted with ketoacidosis. Which nurse diagnosis takes top priority? I'm gonna say deficient fluid volume. They say top priority. I don't see, it's definitely not it. Tissue integrity is not a concern at this time. Maybe deep is infection, but I'm gonna say B because I think these patients might be dehydrated. 34. I'm gonna give you time to be familiar with adrenal crisis. So I'm gonna tell you guys which method that I used when I was taking this test. Okay, it's a 3-hour test. If you already signed up for the test and you're about to take it soon, I'm gonna tell you how I took the like which method that I used. Like the first time, I was very nervous and I was rushing through the test and I was changing my answers, and I was running out of time. And remember, you have 150 questions. So I'm going to share with you guys. I'm going to stop the video in a few minutes. I'm going to share with you guys what I did the day of the test and how I prepared myself for the day. And I'm going to tell you guys, first of all, you do not want to cram for this test. Um, you want to be steadily studying, like seriously taking the test in August and you're taking the test in October. So you can kind of have your study schedule. You know, you're gonna study a little bit every day or every other day, and there are days you're gonna be spending an hour a day on your if you're in your car at work, you have your little flashcards, right? So you have your own study system going on, your methods. But so you're taking the test now. You're taking it in October, right? So, and of course, it's gonna be days where you're gonna be spending maybe like a whole day just studying all the different systems. And remember, you have maybe all your health systems they're testing you on, from cardiovascular, respiratory, to musculoskeletal, to integumentary, um, hematological, the whole system they're testing, neurological, and there's an average maybe of, um 'cause it's 150, you might have 12 questions. Let me see. It's more than that. So it's 6, so 150 divided by 6 sections. So what is that, like, 20, 20 to 25 average in each group. And then when I come back, I'll bring you guys a breakdown of how they, each section, like a little bit over 20 questions, okay, for each group. All right. Um, Okay. And if maybe even today I'll show you guys how they test. So this question right here, did anybody know what's an adrenal crisis? You work with a patient that's an adrenal crisis. Which lab are they concerned with adrenal crisis, right? Adrenal crisis has to do with the sodium level. I believe it's the sodium level, and we'll confirm it when we look at the answers. A patient developed diabetes insipidus after surgery to remove a pituitary tumor, which is in your brain, right? The critical complication, the keyword here in the question, critical. It has to be critical. The critical bradycardia, which is slowing, bradycardia could be a complication, but think like the worst scenario. Look at all the answers and look at the worst situation that could happen. The low sodium, which is hyponatremia. It's not dehydration, okay? It's not C. You can eliminate that. It's not, um, it could be hypokalemia. Any low potassium is always like a critical situation. Okay. Now this question, we're gonna spend in our comprehensive study, who's interested, we're gonna go in a little bit more in depth how to determine ABT values. I'm just gonna give you guys a heads up on the actual exam. There, you just need to know how to identify the ABT value. You do not need to like interpret, like you don't have to find out how the treatment. Um, yeah, you don't have to be doing more than that. You just need to identify it. That's it. They're gonna just ask you, is this respiratory acidosis, metabolic acidosis, alkalosis, or respiratory acidosis? That's all they're looking for. And there might be a little bit of three, like maybe three, not all the person, maybe three, but if you know it, you get an easy answer. You see what I'm saying? You're gonna get an easy answer. Um, yeah. So that's all. So in this situation, okay, so the way you determine it, you're gonna start with the pH. A normal pH is 7.35, 7. And I wish I knew how to use a board so that I can show you guys, but eventually I'm gonna learn how to use a board so I can start writing things down. A pH is 7.35 to 7.45. So I want you guys to look at all the pHs here, okay? So a pH over 7.45 is alkalosis. A pH below 7.35 is acidotic. So, if looking at these right here, which one is alkalotic? Remember, pH is 7.35 and 7.45. Okay? Which one is acidosis and which one is so if you guys guessed it, yes, A. So from elimination, we already found the answer because this is the only one alkalotic, and they're asking you which patient has metabolic alkalosis. So so that means that the person's metabolic has to do with HCO3. So this means that this one is also see what's the normal HCO3, right? So that means the CO2, the respiratory part is normal, and the the HCO3 is not normal. Okay, so just by process of elimination, we found this answer. A patient undergo gastrectomy for treatment of stomach cancer. Which complication is the keyword again? So I wish I could do a highlight. I'm gonna figure out how to use that. So anybody know how to use because I'm on the Zoom, how to highlight these things. Complication most likely is what? I'm gonna say pernicious anemia, but it probably could be C or D. But so this is just something to study and understand and know. Because apparent because it looked like the other two could be complications also. This is a question I just want to give you guys the answer number 38. It has to do with Benadryl. And I find this answer question to be a little bit easy. If you work with Benadryl and let's think about when you're in a clinical setting, you telling your patients what is a common side effect of Benadryl. Okay, think about what's the common side effect of Benadryl. Which one is it? If you're taking Benadryl and you're about to give your patient Benadryl, what will you tell them is a common side effect with Benadryl? Just think about that for me. Okay? Is it coughing? It's not coughing, right? Flushing is like the person is turning like their skin is like flushed. They're almost like, yeah, it's not flushing. Arthralgia has to do with like, with arthritis type. So which one you think by elimination is probably sedation? Benadryl does make people you know how we say Benadryl makes you drowsy a little bit? Okay, this one seemed like a little bit, more complicated because in the med-surg setting, we don't see a lot of cerebral edema, but you might see this type of question on the test. So in these types of questions, there are certain medications that you want to be familiar with. And when we go into our comprehensive study, I'm going to make a list of all the common medications you want to be familiar with when you take the test. Like medications like Lasix, any of your insulins you want to be familiar with, any of your seizure medications, cardiac medications like the Plavix, Coumadin, heparin, you wanna be familiar with all of them. And I'm just gonna say that right there, I didn't see that type of question on this exam. Questions like Coumadin and heparin, you know which labs you need to take to know the labs, for the Coumadin and heparin, like which labs do they monitor for these types of medications, and also know the antidote. Right? You wanna know, like, which medications, that you will do for your Coumadin, which antidote for Coumadin and for both and the heparin, alright? So just be familiar with that, and if you know those are, like, really easy. That's an easy point right there, okay? A nurse is teaching a patient of a child diagnosed with sickle cell. This is another one, you just expect a question on sickle cell, okay? Because that's a common diagnosis. Sickle cell disease. The appropriate instruction to the parent is what? I'll just give a few minutes to just look at this one, and as far as what you know about your sickle cell patients. And if anybody wanna join me on this Zoom to actually talk to me and ask me questions, I can answer your questions. This is, the Zoom is 897-5313-4539, password 403129. Anybody interested in going on the Zoom, you can go on the Zoom and ask me a question, and I will be able to answer you. Okay. All right. So we're moving along. It's 2 o'clock. We're gonna move along. So I'm gonna try. I think when I came in 30, so I'm just gonna do an hour. But I did some of this on my Facebook page, and I just wanna I only was able to go to half of it. So I'm gonna move quickly and move through some questions towards the end. So this one I'm gonna say avoid for this one, the sickle cell, I'm gonna say to teach the parents to avoid low oxygen concentration. I'm moving quickly because I want you guys to see how this test goes through the answers rationale. They do really good with explaining why they chose the answer. And I'm recommending if you are gonna choose any book of your choice to study, right now, I'm going back but whatever book you choose, make sure that you go through, um, the rationale. You know, most of them they'll have answers with rationale in the back. So that way you can do your more intense studying, okay? A nurse is educating a patient with hyperthyroid. That's another thing to know your thyroid's hyperthyroid. What is the most common cause? And I'm gonna say Houston disease. Also know, also make a flashcard on Hashimoto's disease and Addison's disease. Which of the following is not a complication of diabetes? Which of the following is not a complication of diabetes? Just think about I know for sure obesity is a complication of diabetes. And I've also heard several times that they say blindness is a complication of diabetes. So that leaves B and D. They said which one is not? Which one is not? Is renal affected by diabetes or anemia of the person? Okay, so they say which one is not? Obesity is definitely complication. Blindness is definitely a complication. So is it B or is it D? Which one will shall I choose? I'm gonna guess D. So again, I'm gonna say try to make an educated guess for each question. You just never know. Do not, I will highly recommend not to leave the question blank on the test. I'm just gonna put that in the chat. Do not leave, do not leave any question blank on the test. All right. So in a few minutes, I'm gonna share with you guys. If we can, we're probably gonna go till 3. I'm gonna share with you guys really quickly. Um, I'm gonna share with you guys my test results. Let's see if I can find it. But I'm gonna give you guys while I look. Right, where are you guys at? Okay, so which question are we on? Did anybody figure out? Okay, I didn't realize I'm on the question. Okay, you guys looking at 40. Okay, this question right here, I'm not gonna spend too much. I'm gonna answer it, but I don't want you guys to spend too much time with these types of questions. There are very few on the test, maybe 2 or something like that. But it said which stage of nurse-client relationship does a nurse assume different roles? I'm gonna say orientation. I'm not really sure. When giving Haldol, a nurse should educate the patient and family about which common side effect. Think about this is something you just have to learn. We're gonna go over it and try to commit it to memory. What is a common because you like this is like just one medication. I hope you need to, it's like a list of medication you should try to be familiar with. And I'm gonna just go ahead in the chat and just say put here what medication you should get familiar with. So be familiar with common drug medications, including Lasix, Coumadin, your Lasix, your Coumadin, your Lopressor, Digoxin. And anybody here can help me with other drugs. Your Protonix, your Synthroid. Protonix and Synthroid, the questions I've seen on them is like, what time should you take this? And it's kind of mostly recommended that these type of medications are taken in the morning before breakfast, like 1 hour. So that's the common. Your heparin, and I'm gonna say your Keppra, Haldol. So this is a group of medication you should just be familiar with. For Coumadin and heparin, know which labs to monitor and their antidote. And I guess you're limited how much you can and antidotes. All right. Okay. All right. So you got out. I guess you limit how much you can write. All right. So if you know any of your friends who's gonna take the test, just let me know. AMSN just published that they have a live in-person certification review. Now, the review course is 2 days. And they go through every system in your body, the gastro, everything, head to toe, from musculoskeletal, all your systems completely will go through it. Okay. And it's a 2-day course. And that's usually how I see most of the courses are. Um, so if you guys want to check that out on amsn.org, you will get the information about where, how to pay for that, which hospital, how to get into that live course. Okay. So I took the test back in February 2022. This was the second time I took the test. And I'm gonna share with you guys briefly. I think I hope my act. Yeah, I'm gonna show you guys briefly what I'm gonna share with you guys briefly what where I failed. Um, let's see. All right. Okay. So can you guys see? I don't know if it switched over. So I took the test at a Prometric center, like I told you guys. In the Prometric, you take the test for 3 hours. So after you take the test for about 3 hours, it's about 3 hours and a half. 30 minutes is to do the tutorial to show you how to navigate the test with the mouse. Okay, like how to, go. 'Cause you will be able to go through questions, go back to a question. It's not like certain tests I heard that you can't review a question. In this test, you're allowed to flag a question. You can go back to this a 30-minute tutorial. Okay. So I got this at the end of my test. And can you guys see this? So this is what it's gonna look like. So February 2022, I took the test at a Prometric center near me. And so I took the test. And then this is what they told me I failed. And guess what? I believe I failed it by 1 point. This is just this is kind of aggravated. I just was so annoyed because I just felt because I just needed one more point. I think it's 95 to get what they wanted, which was 73%, and I was passed. I just failed it by 1 point. And I probably failed it because I probably changed the name. I think, I was nervous of changing answers. I'm like, "No, that's not it." Like, I'll go back and I'll be like, "Oh, yeah, I think I got it." Okay, so when I had studied again, so they do this so that you can see where you need to focus on. So this is from them, from MSNCB, Mid-Circular Board, okay, and they give you the date, etcetera. They said, "Client, we regret to inform you that you did not achieve a passing score on the CMSRN exam. Your performance on individual domains area indicate below. You can assist to further study if you choose to retake the test," right? So I'm showing you this so you can see which areas that are covered on the test. But for them, they divided in 6 sections. All right. So in dividing it into 6 sections, so just do 150 questions divided by 6. So it's an average, maybe what, 20, I don't say, is it 25? Yeah, it's just 25. If you divide 150 by 6, this says 25 questions. But there's another place that breaks it down. But they say it's not an even 25. They'll say they give you a range. They say maybe 22 to 25. So gastrointestinal is one. So I was average. Pulmonary, which is your respiratory system, I did really well. Cardiovascular hematological, okay, I did. Diabetes, endocrinology, immunology, I did good. Urological kidney, I did very well. This was my strongest point was the kidneys. But the musculoskeletal, neurological, and the skin, I did not do well. So when I went to study again, I had to really, really focus on actually anything that I saw that I got below 70%, I had to focus on. My GI, I had to focus on. I had to focus a little bit more on my so I still needed a lot of studying, okay? But, you study, you will get it. I mean, I had to take the test more than once, but, um, if you focus and you take your time, I think the first time I didn't pass the test, maybe I was a little nervous, So that's why I'm trying to share because I failed it by 1 point. So, yeah. Alright, so I'm gonna go back to the exam. So this hope so if you want, we can do depending if somebody wanna do one-on-one studying, I'm willing to do one-on-one. If you live in the Baltimore, Maryland area and you wanna study with me on the side, I can meet you somewhere and we can study, and I can show you books like how to study, and this might help you calm your nerves and give you the reassurance and the confidence to take this exam. And I'm gonna share with you why you want to take the exam and why you want to get certified. Okay, I think I put it in the chat in the description why you want to. I don't know if I did. Did I? Yeah, but there's a lot of reasons why you want to get certified. I didn't get. I didn't. I don't think I described why you want to get certified. I did say the certification is good for 5 years. Okay. So we're gonna go back to the test real quick and see if we can finish about 3. Okay, so going back to question 46, when giving Haldol, a nurse should educate the patient and family about which common side effect and its tardive dyskinesia. Okay, this one has to do with how often you need to how often do you need to get a colonoscopy? I'm gonna say in the patient, she's 40 and she wanna know when she should take her first colonoscopy. I wanna say in 5 years, I think there's study that's saying that, people need to start the colonoscopy early 40s. So, I'm just gonna go through some questions, and then the most important, I do want to spend more time looking at the answers. Which of the following are least likely to be ordered plastics? I'm gonna give you time to look at the answers. Which one of the following patients are the least likely? Least, just pay attention to the way they phrase it. Least likely. Is it the ischemic stroke patient, the one that with esophageal varices, the cabbage, or the MI? Okay. Did I? Hold on. Oh, I think I'm still on the I'm sorry. I still was on the testing. Okay, so I might okay, so you guys I probably was talking, you guys didn't see. So here's the question. I think when I didn't share the tab so you guys can see. So since I shared my test results with you, this is what questions I went over. I went over question 46, Haldol. The common side effect is tardive dyskinesia. 47, they wanna know how often you need to take a colonoscopy. I'm here guessing 5 years, but we're gonna go over the answer. 48, I didn't spend too much time, and then now we're in question 49. Which of the following patients are the least likely to be ordered Plavix? Just gonna give you a minute to look. crazy. I can't do this just now. Okay. Hello? Sorry, guys. Okay, so the answer is gonna be remember it's least likely. Okay, least likely. So a patient, all right. Which of the following signs and symptoms are not caused by an atropine overdose? Do you guys remember what atropine is for? Okay, they use that usually to slow the heart rate. So which one is not? Which of the following signs are not caused? So say you're giving too much atropine. This one, like, if you're not familiar with atropine, you might not. This might be in terms of difficulty, might be a little bit like difficult. 'Cause if you're not used to working with atropine, and atropine is not a drug you're using on a daily basis in any in any setting. So it might not be easy to find the answer to this. But I mean, it just might be something we're just gonna take a guess and then kind of like this is kind of one of those questions you just need, it's good to know, but it's not something you will see commonly. They asked the question of what's a common congenital cyanotic heart defect. This is usually I used to see this for children. So that's question 51. I just went ahead and answered it ahead of time for time's sake. Which of the following is not a complication patient to have sickle cell? So complication, if you have sickle cell again, I'm saying sickle cell anemia is something you want to do a really good review on, kind of be familiar, the treatment or the symptoms, things like that. And sickle cell anemia, the complication is PE. It could be a complication. Pulmonary embolism, like clots in your lung, is a complication. MI, like people having heart attack, it could be a complication. Anemia could be because the word anemia. So this one is a giveaway. So D, is like so esophageal chlorides. I just write elimination. You pick that one. Okay, here's a question again to just take your time to read. A male patient confides in his nurse about his sex anxiety after being diagnosed with a brain tumor. He denies hallucination of suicidal. Which medication will you give? So remember we saying to be familiar with certain medications. So this is one. And I feel like it's a giveaway, really. I feel like it's a giveaway. Think about it. So your patient is sad and anxiety. Haldol is for your agitated patient, right? Keppra is for your seizure patient. Levoxyl D is another name for Synthroid. That's for your thyroid. Which one by elimination will you give for sadness and anxiety? It will be Lexapro. So we this is an easy one because 54 just has to do with behavior. This one you just have to read it and take your time to read and see. 55 has to do with diabetes insipidus. Which drug do you guys know treats diabetes insipidus? Okay. Is it Kxalate, insulin? It's not Kxalate. It's not Decadron is a steroid. It's not Decadron. Okay. You might say maybe insulin or this. So they say the drug of choice, and I believe I have desmopressin, and we will see why. This one might require a really good review. I might skip this one for now because it's a very involved question. This is more like a case study questions, and you will find a few of these questions on the actual exam. And I don't know if I mentioned it on this study session, but when you have study questions, case study questions like that, really take more time to read those questions and answer them. Don't rush. Um, and you're gonna find a few. Like I'm gonna say a good I'm gonna say 10, 15 questions you'll find. Okay, so this one I'm just gonna answer it, but I we didn't really read to it. So just mark some when question 56 we really need to go through it. And kind of like unpack it a little bit. Question 57 has to do with something called Janeway lesion, which I'm not familiar with. This is a 25-year-old is admitted to the hospital with a fever. So that's one clue, a fever of 102.3. I also want to say on the actual exam, they're gonna give you some little cheat sheet, like draft paper, like I think they give you like two paper where you can write, but you will not be able to go into the test with no electronic anything. Okay, so no calculator, nothing at all. So that might be so. You have these clues. You might want to write this down. Patients coming down fever 102.3. Complaining of fever, chills, and diaphoresis, which means they're sweaty. They're known drug user. Um, the nurse said the patient they have a Janeway lesion. So, anybody heard of what a Janeway lesion is? Based on a history of being an IV drug user, what is the most likely diagnosis? Fever. I don't think it's pneumonia. Pneumonia has to do with the lungs. C. diff has to do with diarrhea, and they didn't mention anything that. So A and D we can eliminate. Meningitis, we know what that is. That has to do with the brain. So by elimination, we're gonna say endocarditis, and then when we look at the just mark question 57. When we look at the answers, we're gonna see which of the following is the first line treatment for Hashimoto's thyroiditis. I'm gonna go ahead and say Synthroid, but um, I'm just gonna say right now, if you're making some flashcards, also go ahead and make flashcards on C and D. Which of the following is a treatment for active TB? I'm gonna say streptomycin, and then we'll go through it. And this one, I went through this with the first. I had a we did some review yesterday. So I'm gonna give you time to read the question. The patient comes to the hospital with asthma. They're using nebulizer. During the exam, the doctor nurse noticed the tongue is very cheesy white patches that can be scraped off. What is that called? So this one I feel like is the easy answer. Um, if you have the cheese, they usually call it oral thrush, and they usually treat that with some nice statin. Which of the following will be treatment of choice in an acute asthma exacerbation? This one, if you're not really familiar with the asthmatic medications, it could be tricky, but this could be also time to review some of the medications for asthma. Mucinex is like a cough medicine. Singulair is a steroid. Augmentin is an antibiotic. So by elimination, we got Zopilex. Which of the following is a complication of paraphimosis? Um, honestly, this is the first time I've seen that medication before. I'm not familiar with paraphimosis in the clinical setting. I really don't hear that word a lot. I don't know if there's another word they use. So if we were to take a wild guess, which one would that be? If we were to guess what a paraphimosis is, can anybody take a guess what it might be? I don't know. Like if you study the Greek or Latin, I think para has to do with osmosis. Yeah. So if anybody can guess what paraphimosis is, and then I'm just gonna go take a guess with this one. Okay. All right. A patient has been diagnosed with deficiency Let's see this question. Okay, can you guys see the question 63? I am kind of like I zoomed it up to make it a larger font, but it might not be working. Okay, patient has been diagnosed with CPD deficiency. Some of us don't know what that is, so this might be a good time to review. So for diet questions, I think I only saw 2 to 3 diet questions on the exam. I don't know if it's something that is kind of like with the NCLEX. Like even when I was taking the NCLEX a few years back, I didn't really spend too much time studying diet. Um, so in this question, you really need to know what a glucose, what type of deficiency this is. So which of the following, the parents asked the nurse which stimuli can cause outbreak symptoms. So which foods should they avoid? So I'm just gonna guess. I'm not. It could be B, seafood. 64. Which of the following is true regarding sickle cell disease? I'm just gonna move along because remember we're trying. I don't know. I think we're running out of time. Um, this question like 65. I think 66. No, yeah, 66. These are really like the level of difficulty is a little bit up there. Like you really need to spend time reading them and really just like studying it for now. Okay. Which of the following is not a sign and symptom of hypoglycemia? So diaphoresis is for high blood sugar. Altered mental status. Okay, what did it say? Which of the following is not? Is not. Okay, which one? So which of diaphoresis is hypoglycemia? Altered mental status, you can get that with low sugar. So A, B is low sugar. Palpitations, you can also get with low sugar. So which one is not by elimination? It's C. And so foodie smelling has to do with high blood sugar, which is hyperglycemia. This one, I'm gonna go ahead and guess it and try to move because we need to spend some time looking at um we need to spend some time looking at your rationale. Back to sickle cell. Which of the following is not an intervention to treat a patient with sickle cell? In question 146. I'm gonna give you guys some time. Again, this test, we have to do a comprehensive study because just 2 hours is just not enough time. Um, and then, like I said, you can go back on your own and take your time and really studying. Maybe you can do it all in one day. Like, just break it down, like whatever works. Break it down. Do your tests. Like maybe do like because it's 150 questions. Maybe do 50 questions today. 50 and kind of take your time. Like take your time to digest it. Like break it down. Really take time on each question. Like say you have 1 hour, 2 hours to study for the day. So say you're gonna study through the weekend. I will do 50 today, 50 on Friday, 50 on Saturday or Sunday, and then kinda like maybe one day go through everything again. And of course, you have other material you're using. Okay, so this is for somebody who's probably, if you're gonna be taking a test maybe next month or in October. You just kinda go over that, and don't forget all the different sections, okay, that you have to study. But this test is not as intense as, um as the NCLEX. The NCLEX, yeah. A nurse is being discharged on niacin. So this again, this is a drug you might also want to be familiar with. Which of the following is a common side effect of nurse? So you that means you'll need to be familiar with niacin. I don't. What's a common side effect of niacin? Is it the one that makes your urine orange? I'm not sure. I'm gonna say flushing. I don't remember. Um, this again is like we can go through it. They said, "Do you want to finish?" Oh, are we on question 150? Oh boy. Okay. So we already at question 150. We're already at 150. Um, I'm gonna this one last question. 143. A patient is being discharged with low pressure. Which of the following is a common side effect that the nurse shall educate the patient about? I don't remember this one either. I'm gonna say fatigue, but I don't know. So at this point, I'm gonna go ahead and finish and see if we can go through. But then at this point, you're gonna have to go over it because, of course, we didn't answer all the questions. Okay, 40 unanswered questions, but despite this, we got 62%. Might not be like we didn't answer it. We didn't answer all the questions. But I'm just gonna show you how this format is and how you can see. I just want you guys to look at the rationales. That's the most important thing. When you're doing your intent study, I want you to really spend time and look at the rationales. All right. So I'm just gonna go through some of the questions. Okay. So this is just today was just a preview. I'm going to pu- make some announcements soon, and I think just like the way I was recommending to you guys, I think I'm gonna come up with like a few study days where I'm just gonna break it down so that way, like we have the time. It might be like 2 hours at a time, or maybe 2 to 3 hours at a time, where we do 50 questions at a time. So that might require like 3 days. 50 questions at a time, really taking our time looking at the questions and the answers. That look like it might take 3 hours. I don't think 2 hours might not be enough. Um, okay. So, 'cause right now, so I just want you guys to look at the questions and spend after you do the questions, spend more time on the answers in this section right here. Okay. Um, so this 64 is a sickle cell question. I don't know if we saw this one. This was the G6PD, and it actually has a hereditary disease. So spend the time to really look at the answer. Okay. All right. So okay, so this is that. Um, then I don't know if we saw this question, paraphimosis. So this is what a paraphimosis is when the force. So this is how you want to study for these types of tests. You really want to take your time and just go over it. And of course, you have other materials. You're not gonna be using this. Okay. All right. So I'm gonna bring this to a conclusion. To just say like this was more like a preview. Because you can always go and study on your own. Um, and go to this website. Just know that you can use, using several material when you're studying. So you just have to plan your study. Honestly, you have to plan your study because this is just one material that you use. Okay, so I'm gonna end with and then after I finish this, I'm gonna go turn off the camera and come live and share with you guys like how I took the test. Okay, so here's the niacin. A common side effect of niacin is flushing. Niacin is used to raise a patient's HDL, which is the high density lipoprotein, or their good cholesterol. Okay. A patient should be started on the lowest dose possible to prevent adverse side effects. If flushing occurs, the drug dose does not necessarily have to be discontinued if the patient is able to tolerate the side effects. Okay. All right. So, okay. So I'm gonna end it here, and then um, I'm just gonna say that we just have to plan your study. Okay. And yeah, you just have to plan your study. So I'm gonna go back. mm, I'm gonna end on that note, and I want you guys to look out for announcements for when I'm gonna do the next study. And if you ever interested, just contact me directly. Yeah, just contact me directly if you guys are ever interested in doing studying, like your own private study. Just let me know, and I could schedule accordingly. Um, Let me see. So I just wanted to briefly share with you guys what my study, how I took the test. Okay, I just want to share with you guys how I took the exam. All right. Okay. All right. Okay. So yeah, I don't know. Well, I can share with you guys briefly. So when I took what happened, so the test is 3 hours, right? So I got to my location really early. So say the exam was at 2 o'clock. I got there like 1 o'clock, 1:30. No, it was a little bit before that. I brought a snack with me, and basically the system that I use is that, when you go to the Prometric Center, they are going to screen you. They're gonna make sure that you don't have no electronics. It's kinda like you're at the airport, and you go through this part, they even look under your socks and everything to make sure you don't have anything with you, to cheat. So, they give you a locker for your personal belongings and all that. That's why you wanna go early. And I did bring a sweater because sometimes the, locations can be cold, okay? So I go in there, it's 3 hours. I kinda, I don't spend too much on the tutorial. This was the second time I was taking the exam. I didn't go through the I didn't spend too much time in the tutorial. So they gave me about 3 hours to take the test. So the first hour, say my exam started at 2, from 2 to 3, from 2 to 3, 3:15 or so, I my strategy was to go through the whole exam from 1 to 1:50. So what I did was any question that I knew, I like, okay, I know this for sure, like 80, like close to 90% no, I went ahead and answered it immediately. Okay, so I went through all the questions one by one, the ones that I knew that, okay, Lasix is a diuretic. I went ahead and answered it. You know, anything that, like, to me seemed like easy was, I went ahead and answered them right away. The ones that I knew that I needed to kinda, like, go back, I went ahead and flagged them. So that was my thing. I went and flagged the questions I didn't know. So when the hour was over, I wanna say that I counted about, maybe out of the 150, it was about 50 questions, close to 50 questions that I knew for sure. So that means that 2/3 of the exam was, like, question mark, okay? So the second hour, so after my first hour, I took a break, went to the bathroom. Just be aware that while you're taking a break, the clock is still ticking. It doesn't stop because you take a break, okay? The clock will still be ticking, and you can take as long as you want. Like, I don't even know, I think people could take an hour break, and I don't think anybody's gonna tell you not to take an hour break. But, I mean, so the computer's just gonna keep clicking, ticking. So I took about a 15, 20-minute break. I went to the bathroom, I went in, I think I left my, snack outside my locker. I was able to take a little drink or something like that, and then I went back. They had to screen you again. They had to, make sure, um, I think they asked for your ID or something, and they kinda go through your socks and everything before you go back in the room, and then started the exam again for my second hour. My second hour, I just went back and focused on the questions that I flagged. So I focused on those questions, and then the last 45 minutes, I focused on I just did one final review. 30 to 45 minutes, I did one last final review, and that's the strategy I basically used. So this just to help you, if you want a person who has test anxieties, this might help. And I also have to add that I used the tools that they gave me to highlight. I paid attention to words like "except," "not," those type of words you really need to pay attention to, and kinda like, um, took my time, like, paced myself, and then after the exam is done, they ask you to do an evaluation, and then I think within minutes, you sit there, and then the computer will tell you if you pass or fail. And you can imagine my joy when you told me I passed. I was so happy. I'm gonna see if I can share with you guys what um, I passed, like what it looks like. Like they'll tell you on the let me see, they'll tell you on the exam. Okay, so at the exam site, they'll show you, and then you'll get an email later on showing let me see. So I'm gonna go ahead and show you guys what my report looked like when I actually passed. Okay, so let me show you guys. I'm just gonna share that screen. All right. So I think earlier I gave you guys some misinformation. So remember when I told you guys that let me see. I think I was telling you guys earlier. Yeah, I told you guys that, oh, you know what? I think I'm only 1 point away from passing, but now that I'm looking at the actual test, it looked like I was, let me see. Last time was 94, so I needed a 99, right? Or- Well, actually, no, I didn't give misinformation because I did read that 85. So I passed here with a 99. So yeah. So I still you can pass with like a 95, you can pass. So I did say the truth. I wasn't on field. But here I actually pass. And if you look at the score, if you look, everything was above like 70 and above for me to pass this. Okay. Did you guys notice that? The last time I showed you my scores, I was at 60% in 3 categories. I was like in the 60% in 3 categories. But here I'm at 72, 76, and did very, very well in cardiovascular and GI, and my musculoskeletal is yeah, so I did really well in those my first 3 categories, I did very well. I did over 70%. So that's what really, did did really good. So, yeah, so since February 24, 2022, I've been doing really good. Did I? All right, so that's it. So I'm just gonna end on this note. Happy studying. And I think I had mentioned earlier before that I will just say to plan your study, do the I will do, you know, maybe 3 days, like if you do the Prometric practice study guide, I will do 3 days of it. Like break it down in 50 questions a day. Just break it down that way. Um, and then of course it's gonna be days where you're gonna need more time to like maybe like a whole day just to just review everything. Of course you use the other material. So, just plan your study. I'm willing to study with you guys. So whatever material you want to review, I can do a study review course with you guys and help you, be like, let's do flashcards on this just so that can be very helpful. Okay. All right. See you guys till next time. And just contact me. Let me just put my contact information here. I am on Instagram and on Facebook. Let me just put my contact. Okay, so yes, I'm both on Facebook and Instagram at Nurse Travels. I give you guys my email, so just contact me. All right, thank you.